There is a behavioral health crisis in this country that was really exacerbated by COVID, and certainly even more so among Medicaid beneficiaries, communities of color, vulnerable communities.
Many of our behavioral health members would prefer to have an interaction through a telehealth visit than the in-person visit.
My anxiety was really, really bad, and I was more depressed. I wouldn't have known about telehealth without Amy.
When I first called Shannon, she was facing a bunch of medical conditions, dealing with chronic pain, had limited mobility. Shannon, can you talk a little bit about how you've used telehealth?
I'd use it to speak to my psychiatrist and my counselor.
And how often do you typically talk with the counselor?
Like once or twice a week, or whenever he's available. But I usually can just either text him or call him, and if he's available, he can call me back or something like that.
Centene continues to increase our commitment to telehealth, and it is really thinking about digital interactions with our members. We want to be able to open our toolbox and offer them the services through the mechanism that best meets their needs as an individual.
This is where leveraging technology for the most vulnerable populations is really something that we're uniquely positioned to do.
It's not only about linking members with healthcare services, but also working with members to help them have a healthier life, and what are the things they need to do and have access to make that happen. What is it that you think has been most helpful about telehealth?
I just find it better talking to this person to his phone than I do in real life.
If telehealth wasn't an option, where do you see yourself right now?
Stuck in like kind of like a depressed, and my anxiety was really bad. And since I've been talking to telehealth, it's helped a really lot.
This is a really good example of creating more access and open access for our members.
I think people use the term innovation when they think technology, but for me, the innovation is around identifying the problem and then solutioning at scale for people who need it the most. That's the innovation.